Good morning, everyone, and welcome. Welcome. It is 11 o'clock, and we are going to go ahead and get started. I'm going to say again, good morning, and welcome to the virtual spotlight on essential health careers at College of DuPage. My name is Tamara McLean, Director of Admissions and Outreach, Campus Central, and International Student Services, and it is my indeed pleasure to welcome you all to this amazing event. For the next few hours, you're going to be engaged in some interactive topics presented by experts in the health careers industry that's going to get you going into this field as a prospective student, as a returning student, or just a community member just interested in learning more about the health careers field in general. It is my pleasure to be able to welcome you to this event. I'm going to introduce you to Debbie Jaffe, but before that, I want to give some special thanks. First and foremost, I want to thank our administration for supporting us with this event, our foundation for supporting this vision and the mission to our Nursing and Health Sciences Division and the Office of Admissions and Outreach on supporting the interested students that want to get more information about the health career fields, and most importantly, our adult team that worked very hard to collaborate with the foundation on putting this vision together on paper, having it approved, and seeing this materialize into this amazing event today. So I am very proud to be able to introduce one of those recruiters that initiated this project a couple of years ago, Debbie Jaffe. Debbie?
Thank you, Tamara. And hello and good morning. As mentioned, my name is Debbie Jaffe. I'm an adult admissions rep for the College of DuPage and will be moderating today's event. Let me introduce my coworkers and partners who help coordinate this event. Angela.
Thank you, Debbie. I'm Angela Nakovic, one of the adult admission representatives here at the College of DuPage. I've been at the college the last 23 years, and I want to welcome all of you to this wonderful virtual session today. Thank you for joining us.
And Gosha.
Hello, my name is Gosha Varias, and I am an adult admission representative. I hope that you will learn more about the future of healthcare and feel inspired to pursue one of the degrees offered at COD.
All right, so let's go over some virtual housekeeping tips. So we're going to please make sure that your microphone and videos are off. If you ask your questions in the Q&A box at the bottom of your screen, and they will be answered at the end of this presentation. We will also ask you to complete a feedback survey at the end of this session. Today, we have a drawing for 2 free $450 tuition vouchers and 10 $50 free bookstore vouchers at our Follett's bookstore. They will be announced at the end of the webinar today in our closing remarks. All vouchers must be redeemed by June 1st, 2023, and that'll give you some time to come to College of DuPage. So let's go over the agenda. So we're going to start with a welcome, as you heard from Tamara McLean, who is our supervisor and is an amazing woman to work with. And then we are going to move on and thank our sponsors. And then we're going to welcome our keynote speaker, Deb Terry. We have 3 amazing faculty that are joining us today, Dr. Janice Miller, Anna Campbell, and Krista Brennan. And then you're going to go on the first ever virtual tour of the College of DuPage and Health Science Building with Rio Amaria. And then our closing remark with continuing ed, our drawing and survey. So we hope you enjoy today, and we are going to get started. So let's move on. We'd like to take the time right now to thank our sponsors. Without them, this would not be possible. The College of DuPage Foundation and Bright Star. Maureen Wood, the community liaison for Naperville Oakbrook Bright Star, is joining us today and has a message and video to share with us. Maureen and her team will answer questions after the video. Maureen? Maureen, did you want to say a few things before we started?
Yep. Good morning,
Okay.
everyone. My name is Maureen. I'm with Bright Star Care. Bright Star Care is a private duty home care, medical and non-medical staffing agency delivering exceptional care and service to clients. Our mission at Bright Star is to improve the health and well-being of those entrusted to our care. From our industry-leading employment standards to our nurse oversight on every plan of care, we are committed to the highest levels of quality, support, and customer satisfaction. As a result of this ongoing commitment to quality, we have earned accreditation from the Joint Commission, the same organization that accredits the nation's best hospitals. We have also earned 2021 Best of Home Care, Leader in Excellence, Provider of Choice, Employer of Choice Awards from Home Care Pulse, a national third-party quality and satisfaction research firm. Our employment standards and practices have received the Gold Seal of Approval from the Joint Commission, which is the nation's oldest and largest standard-setting and accrediting body in healthcare, and has rigorous standards that go above and beyond state requirements. This accreditation is recognized nationwide as a symbol of quality that reflects an organization's commitment to meeting superior performance standards and puts Bright Star Care within the elite group of less than 10% of in-home healthcare agencies that have received this accreditation. We were awarded Joint Commission's 2020 Enterprise Champion for Quality Award, and we are celebrating our commitment to achieving the highest standards of quality and safety in home care. Thank you for joining us today. Enjoy our video.
Remember all the things we used to do? We'd live, laugh, and play without a care in the world. Soon, we'll do them again. But first, we need nurses and caregivers to provide the best home care in the world. Join the best and brightest and help us continue to build a better future. Visit brightstarcare.com/careers.
I would like now to introduce my partner. Megan Bennett is our Director of Recruiting, and she has a message for you. There you go, Megan.
Thanks, Maureen. Hi, everyone. Welcome. I want to say thank you to everybody for having us today. We are honored to have this partnership with COD. I'm very excited about all the speakers today. I am the recruiting manager over at Bright Star Care for the Naperville and South DuPage office. We are always looking for the best of the best. Like Maureen said, we are the higher standard in medical care. We also won Franchise of the Year, which is awesome. And we're a great place to work. So if anybody is interested, I'd love to talk with you. We're always hiring caregivers, CNAs, LPNs, and RNs, and you can go along the way and earn all that experience as you're going through the amazing nursing programs at COD as well. So I will put my contact information in the chat. And if anyone would like to reach out, I would love to meet you. Thank you so much. Thanks, Debbie. All yours.
Thanks, Megan. And it's been a wonderful relationship that we've had with Bright Star. They've hired many of our health science students that are currently working, have currently worked for them, and they even offer tuition reimbursement. It's a great place to work, and I truly love our relationship. Thank you again, ladies. And now it's my pleasure to introduce Angela again, who will be introducing our keynote speaker for the day. And our keynote speaker and Angela will be answering questions at the end of the presentation. Angela.
Thank you, Debbie. It's my pleasure to introduce Deborah Terry, who's our keynote speaker, and a little bit about Deborah. She's the president of the Nash Group, which is a leading healthcare consulting and advisory group. Deborah has more than 30 years of experience of nursing and human resources. She holds a BSN from Elmhurst University and a master's degree in nursing and healthcare business administration from Xavier University, as well as a senior professional in human resources. On a personal note, Deborah, or Debbie as I refer to her, is my former boss. I worked as Debbie's nanny as a senior in college. and to her family. So it's my pleasure to still have this working and professional and personal relationship with her. And it's my pleasure to introduce Deborah Terry, who will talk about healthcare and careers in the present and future COVID era. Debbie? And we will
unmute and
awesome.
start my video.
Sounds great.
There we go. Hey, thanks, Angela. And you know, I have to share with you a little bit of a personal story. You know, Angela did watch our sons for a summer. They were in grade school. And I remember on her last day, you know, she was heading off to college, summer was over, and our 2 grade school sons sat on the front porch and they just cried. You know, they were just so sad to have the summer end. And you know what it tells us? It tells us that we don't always appreciate the impact that we have on others. And you know, Angela's had just a great impact on our family. And I agree, Angela. It's been nice that we've been able to stay together and share this. So let me see if I'm doing this correct. Can you see my screen okay? Did I click on the right one?
Yeah, you have to share. I think you're able to share your screen, and you just have to make sure we don't see it yet, but hopefully we will see it
Okay,
soon.
you know, Angela, right. First thing I do is click share screen. And then the next thing I do is click over here. Hey, thanks for the help.
No problem.
Is
We
that
got
much
you.
better now?
We got you. We could see it. Thank you.
Okay. Let me tell you a little bit about what we do in the NASH group. We work with healthcare providers around the country, and just some of the experiences that we've had that have helped me understand how healthcare organizations need to go forward and recruit and bring in the talent that they need. Let me go over here and go to my slideshow. Okay, do you see the NASH group screen right now?
We do.
Okay, good. So a little bit about some of our experiences. I think one of the most interesting ones for us is, you know, we were asked to take a look at the staffing for Rikers Island in New York for the prison. And so we needed to look at their different pieces. The real focus there was safety. And it wasn't just nurses and physicians, but obviously when you look at the clientele, the other piece that we needed to include was security guards and police. And just like a hospital has to have a plan B when their emergency room gets overwhelmed and maybe they have to divert ambulances other places, we needed to build that into the plan. What happens when prisoners become unruly and the plan for the day needs to change? Well, you need to have the staff there to be able to support that. And then on the other hand, you know, we've got small hospitals in rural parts of the country. And an interesting way that they operate is that they're paramedics in the community when they get called, let's say, to an accident or they get called to somebody's home. When they put that patient in the ambulance and they bring them to the emergency room, that paramedic comes into the emergency room and actually works as a hospital employee. So a different focus there. Some other ones is, you know, you might be familiar with what we call rapid response teams. That's where if you're a respiratory therapist or a nurse or really anybody working in a hospital and a patient doesn't look like they're doing so well, you're not really ready to call a code, but the patient looks like they could use some deeper assessment. So you call the rapid response team. Now, in most hospitals in the country, that would be somebody from respiratory therapy, probably an ICU RN would come to the patient's room. But if you've got a big enough footprint like the University of Alabama, they have a roving rapid response team. So if you were employed there and you were in the rapid response team, you would literally be gowned up in scrubs and you would have a small piece of luggage like you see somebody walking around the airport with. And in that piece of luggage would be resuscitation equipment. And the blueprint there is so large that you really couldn't have a rapid response team respond rapidly from the ICU to any place in that footprint. So they have a rapid response team. And if you or I were on that team, we show up for work, we put our scrubs on, we grab our luggage, and they just roam the halls. And I shouldn't say roam, you know, it's a prescriptive plan. But they also work in tandem with the helicopter team, the transport team. So this week I might be covering this medical surgical portion of the hospital. And then next week I might be on the flight team, which needs to get called out. And then you look at some place like maybe Children's Memorial that we have here in Chicago. Now, an interesting thing about Children's Memorial, if you were in charge of the recruitment and the staffing for them, all of those neonates that are being cared for at Children's Memorial got there via transport. They don't offer labor and delivery services. So if you were building that recruitment model, if you were building that staffing plan, you can see that depending on where you're working and what you're working in, that really dictates what happens. And the cool thing about it, the thing that I like about it, is that it gives us in healthcare some great mobility. But remember who you're working for. If you're working on Rikers Island or you're working at Children's Memorial, you know, you're really working in that environment that's serving that community. And depending on what the community is, it could be pretty awesome. But I wanted to talk a little bit about COVID. You know, these are the large sequoias, sequoia trees out in California. And I look back to about 18 months ago and look at any of us, there was probably some number of us that were thinking about our careers pre-COVID. When COVID came in, it was overwhelming. It was larger than us, and to some degree it still is. And our ability to think through our careers, our ability to think about moving to the next step, or our ability, if you were laid off, just to look at getting another job was truly overwhelming. We've really never had anything in our country that cuts such a wide path, just a real swath through every type of employment industry in the United States. And the dust hasn't completely settled, but we're at the point now, and I'm going to share with you what we've seen most recently and what we're seeing in the future. But we're able to see that while it was overwhelming, there are some industries and some career paths that did better. There were some that had some staying power. There were some careers or some industries that were a little bit more nimble. And so it's not like they did fantastic, and I don't know if I'm using the right term, but they did a little bit less bad. Is that the right term? They survived a little bit better. So taking a look at those different careers that are out there, those different industries that are out there, if you're looking to start your education, or you're looking to jump back into the career field, maybe you've been at home for a while, or you're thinking of what's called a professional pivot. You're in a career and you know it's providing a paycheck, but it's really not providing much more than that. So you're thinking about that pivot. What could that next step be? I'm going to take you through a couple of pieces. And one of the first things that I find really interesting is, you know, how often do we change jobs? And again, COVID's had an impact. Pre-COVID, the average number of jobs in a lifetime was 12. We're now looking at the average number of jobs that any of us will have now in our lifetime is more like 16 to 18. And that could be from people who either had their hours cut, had their position cut, or you don't like your job anymore because you have to work from home or you can't work from home. So one of the things that COVID has done is said, changing your job several times in a lifetime is perfectly acceptable. And we're now starting to see that the ability to change our jobs and change our careers really helps us with our satisfaction. The one thing we know, and this is from the Bureau of Labor Statistics, that in every age category, so if you're starting out your career or you're thinking, I want to end my career in a different way than I started it, we know that those growth rates and adjusted for inflation are higher for people who have more education. So I know it seems overwhelming to stand on that threshold and think, well, what do I do next? Is healthcare for me? And what exactly is healthcare? Here's the important piece I want you to take away today. And that's that you don't have to see the whole staircase. You just take the first step. So we're going to be taking a look at healthcare, but when I'm sharing the statistics and the data with you, remember, all you need to do is take the first step. Take that exploration step. You don't really need to jump in with both feet. So let me share a little bit about what industries we're seeing in the country and how they kind of survived and how they did with COVID. Here are the numbers for the year 2021, and we're looking at the largest industries. Now, a little bit about this that you need to look at a bit deeper is the number one industry being public schools in the United States. That number of 6 million, that was not capturing teachers who taught outside of the public school system. It was not including any faculty that were teaching at the baccalaureate master's level if it was not a public school. And when you take a look at the hospitals in the United States, that 5 million number, what's excluded from there is anyone who is working in home health care, anyone who's working as a school nurse, anyone who's working in the surgical area that's maybe in an ambulatory setting. So these numbers here, while they're impressive, they don't really tell the whole story of who are the big employers in the country. So I'm going to share with you a couple of the statistics from our company, the Nash Group, on what COVID did for staffing. A little bit of a busy slide here, but let me tell you what's going on. We looked at our hospitals, and only our hospitals that were in metropolitan and major cities. So we excluded our hospitals that were really running more in that community and rural size hospital. And what we did is the application that we've developed takes a look at what's going on in all of the inpatient units 6 times a day. So we literally, if you look over here on the left, I'm sorry, I don't have my pointer. There we go. If you look over here on the left, it says like 1 a.m., 5 a.m., 9 p.m. In fact, let me pull up my pointer right here. Pointer options, laser. Okay. You see these times over here? So we were taking these snapshots during those times every day on the medical surgical units and our larger hospitals across the country. And then we continued to take those snapshots during COVID when they were having to staff during COVID. And what we found was that in the most recent 12 to 14 months, when we really had that big push, that real intake of COVID patients in the hospital, we saw that the medical surgical units, that the RNs were taking about 1.2 fewer patients. So if my assignment pre-COVID was I cared for about 4 to 5 patients on my shift, that changed to about 3 to 4 patients. And it's not that the nurses had time on their hand, it's that the workload and the acuity of the patients were so high that nursing needed to take a lighter assignment. So that's looking across all the med-surg units. The next thing we took a look at is all of the ICU units. And an interesting piece about the ICU units, and taking a look again at those same times, in our ICU units, especially in the large hospitals in the metropolitan areas, typically every RN has 2 patients, but there was also pre-COVID periods of time where an RN was taking just 1 patient. So that's how they were running pre-COVID. During COVID, we saw that the RN's assignments got a lot closer to a 1-to-1. So if you had 25 ICU beds in your medical center, you needed about 25 RNs, maybe 23 to 25 RNs. So we saw that really explode. The next thing we saw with respect to employment and what COVID did is that pre-COVID, for every one ICU bed, and look across over here, there are now 2.6 ICU beds. So what we saw here were those field hospitals opening up, those tents opening up. One of our hospitals in Southern California was building a new wing. They were just about finished with the top floor, and they brought the tents in there because they had the oxygen piped in and the electricity, but they didn't really look very nice. So they brought the tents up there because for every one ICU bed that we had pre-COVID, the hospital now has 2.6. So they've increased their number of ICU beds. For every one ICU nurse, we now have 1.4 ICU nurses. And here's the real piece that really brought us to our knees. For every $1 of labor cost, hospitals are now spending 2.2, more than double. And if you talk to any chief financial officer or anybody in a hospital who's familiar with the finances of the hospital, they'll tell you that the number one expenditure, and it was pre-COVID, were the checks that they wrote to their employees. It included their wages, the time and a half. It included the tuition reimbursement, the healthcare benefits. So when you think about a hospital, how it changed, how it morphed, that we had more ICU beds, we had nurses taking fewer patients, so the demand for nurses went up, the demand for respiratory therapists went up, and we needed to pay them. And so the hospitals were now spending just huge amounts of money just to try to keep them going. So huge impact. But what makes healthcare so special? You know, we looked at the different industries and we saw that there's an education, there's healthcare, there's the entertainment industry. What makes healthcare? How do we carve healthcare out and say, why is it so special? Well, there's a couple of pieces. We talked about the demand, and many positions are in demand, but what makes healthcare so special, especially in the COVID environment? Here's an interesting statistic. When you look at all the non-healthcare sectors, you look at education, you look at entertainment, you look at farming and agriculture, you look at all of those different sectors, because of COVID, they decreased their labor or their number of jobs, by about 12.5%. So everybody saw a drop. Either people were laid off or their hours were cut, or they had to quit because they had to stay at home and become school teachers for their kids that were now doing remote learning. So there was a 12.4% drop. But healthcare, the decrease was only 6%. So we experienced a decrease, but we did not experience near the decrease that everybody else had. And one of the important things to take a look at, and only healthcare can make this claim, is that our future jobs, we're projected to add more jobs than any other occupational group. So healthcare is there. We've really had to take the biggest, I think, impact. We had patients coming into the hospital. They were sicker. We didn't really know initially how to treat COVID. So we were kind of learning as we were treating the patients. And in spite of all of that, we only saw a decrease of 6%, and we're going to be adding more jobs. Now, a note about that decrease in this 6% here, when they looked at healthcare, a lot of what contributed to that 6% was a decrease in dental care. People were canceling their, appointments with a dentist if it was just for routine teeth cleaning. And the other piece that contributed to that 6% drop was the ambulatory setting. But now we're starting to see, just in this month of April, that ambulatory is picking back up. And we're also seeing that dental care is picking back up. So we experienced the lowest and we're rebounding the fastest. And the other piece is that of the 30 fastest growing occupations in our country, 18 of them are in healthcare. So we're seeing those new occupations. So for example, telemedicine. You know, telemedicine 2 years ago was not nearly what it is today. And maybe that was a bit of the silver lining in the COVID cloud. So when you look at what makes healthcare so special, look at those demands. The other thing that I really like about healthcare is the mobility. When we look at healthcare and we look at mobility, what we're talking about is the ease for us to move across positions and promotions. So for example, if I work in a hospital and I decide that I'm going to work in the sterile processing center, which is usually connected to the operating room because that's where they're taking all of the trays and all of the equipment and they're bringing it over. And it's not an easy job to understand how all of that equipment needs to be cared for and cleaned and returned to the operating room. So I could get a job there initially. And while I'm in the hospital, I could say, you know, I think I might be interested in being a surgical technician. And the hospital that I'm at has tuition reimbursement. And the hospital that I'm at has some flexibility where I could take a look at going back to school and getting that degree. So the mobility within a hospital or within a healthcare organization is very good. And also the ability to move outside of my current employer. So for example, we really want to take a look at location. If you're in healthcare and you're living in Southern Florida and you say, geez, you know, I always wondered what Alaska was like. You can get a job in Alaska, you know, and the hospital there or the healthcare organization that hires you will probably be talking with you about relocation fees. And speaking of location, this was a nice surprise for me. This is taking a look at who are the largest, the employment levels are high in these metropolitan areas in the United States. And right there, number 3, we've got Chicago, Naperville, Elgin. So we're really in our location, in our geography in the Midwest, we are really well situated to put those new jobs out there and to offer the flexibility to people to come and work with us. So one of the things to take a look at is we're starting to feel a little bit now when people are saying, well, is COVID moving on? Or do we have a better handle on it now? You know, one of the things we saw in the hospital was that they were having difficulty with maybe having to cancel elective surgeries. And okay, I'm sorry, I was just looking at a message that somebody sent to me. So now that the COVID dust is starting to settle a little bit, you know, we're wondering, is the demand going to stay in healthcare? And the answer is yes. And will that demand shape and take a little bit of a different look because of COVID? And the answer to that is yes. Sorry, I hit down and my down button didn't go. Okay, sorry, there it goes. This was just on New York Public Radio a few weeks ago, early April. You know, a cool thing about NYU in New York, a large health system in New York, and we work with them. In the lobby of the hospital, they actually have New York Public Radio, and it's kind of a glassed off area. But when you go through the lobby of the hospital and you look, there's physicians in there, there's nurses, there's other people in there, and they're actually doing a live NYPR. And last week they were on early April, and they were talking about what we're calling long COVID or long hauler COVID. And this is that group of 10 to 30% of the people who survived COVID, but they've now got this, they're calling it a cluster of long-lasting effects and complications. You know, we're seeing some neurologic deficit there. We're seeing definitely some respiratory challenges for people, 10 to 30%, not everybody. We're seeing some cardiac issues. So this population, they survived COVID, but they're here to stay and they're going to need health care. So what's the employment response to that? Well, the National Institute for Health Care and Excellence, also referred to as NICE, has said, look, we're going to be providing this care in the community. These people are discharged from the hospital, and we know that about 10 to 30% of them don't go back to the life they had before. Our workforce plans are going to need to recruit nurses and respiratory therapists. Potentially, we might need to go out and look at the people who've left the profession and say, could you come back into the profession? Could you come out of retirement? And the reason we need to do that is just because the need is so great. So again, we're seeing this new kind of caveat open up in the post-COVID environment. And just to pause and think for a moment, while COVID has come in and we're able to provide care, remember that all of those other diseases that we were managing, that healthcare was having to address and care for, they haven't gone away. We're still looking at addictions being one of the top perils that our country is facing, and how are we going to be providing care there? So remember, it's not just a COVID issue, and if you're looking to come into healthcare, it's not just COVID that should attract you. It should be that healthcare offers great demands, great opportunities. So let me just recap, because I wanted to get time for some questions. When you want to look at your next career step, you want to work in a field that has demand and it offers mobility. So it's not just demand, because, you know, the car wash, you know, we need people to wash cars. You drive by any car wash, there's going to be a sign outside and it's going to say hiring now. There's a demand there, but what kind of mobility are you getting? You're not. So you want to take a look through the lens for your next career step is what has a demand and what gives me mobility. Because remember the turnover that I talked about? The job that you are looking for today, you're probably going to be changing jobs if you're starting out in excess of 12 times. So you want to be in that field that offers you that mobility. It might be upward mobility and it might be lateral mobility. I'll give you an example of lateral mobility. Nurses who work in the emergency room. We've now seen legislation in 12 states where emergency rooms now have to have SANE, sexual assault nurse educators. And these are the nurses that may be in the ED or they may be on call. And whenever there's a sexual assault, and legislation drives this too, that the ED needs to respond. And those are the people who are coming in, caring for the patient, collecting the evidence, working with that patient in the litigation system so that they can go forward. So again, healthcare really offers that mobility. And remember the point from a few moments ago, education that increases your earnings and your marketability. And lastly, and then I'll ask Angela to see if there's some questions. Community college is an excellent first step. Do a little bit of reading about starting out in a baccalaureate program versus starting out in a community college. Take a look when you're going to be writing that check for tuition and you're looking at those early careers, especially in healthcare. A great place to take a look at is the community college to kind of broaden your perspective. So Angela, I'm going to stop talking. I'm going to turn it back to you. I don't know how to turn it back to you, so I hope you know how to turn it back to you.
I am back, and you know what, Deb, if you can stop sharing your screen, then we got some really good questions that I'm going to send your way, because I certainly am not the professional with this, so I want to make sure that the professional answers. One of the questions that we got was, does ageism exist in healthcare? I've received feedback from former or retired nurses stating that early 50s to start nursing school will not produce the fruit from all the plantings. Can you speak to that?
Oh, false. Absolutely false. You know, especially when you look at, well, here's something that I read a while ago. It's important. If you don't go back to school because you're, 55 years old and you think you're too old and you live to be 70, 5 years from now, you're 60 and you don't have a career. So absolutely go back, because, sometimes when we think of ageism, we think of workload. And I might think, geez, I can't, I'm not equipped to work the night shift anymore, lifting heavy patients. Come out of that microscopic view of what you believe a nurse is, get the education, and then expand and look. Maybe being a school nurse would be a great job for you. And so you're going to want to talk to people who have an expansive view of nursing, and don't hesitate around age. Absolutely don't. I just saw a video the other day on NPR, and it's a 96-year-old physician working in primary care, and she loves it, and she's there. So don't pass on education. Don't pass on your career because of your age. You're going to meet some great people out there, and go for it.
That's great. Thank you. This next question we have is just complimenting the presentation. This has been a great overview of the healthcare professions, the demand, the effect of COVID-19 on our healthcare system, and potential of lifetime employment. And love the example of the sterile processing technician speaking to the hospital about tuition reimbursement. So thank you.
Good.
Thank you for bringing that up. And let's see what else that we got that. Thank you for bearing with me as I'm manning the controls here, making sure that I'm getting these questions. So, and then just a good comment about pursuing nursing after 50 as well. So
it really is. It's I can't say enough about it. I really can't.
Yeah. And there any other questions out there? Deb, one question, here we go. I think we just had another one. I have been a retired clinical social worker for 20 years, an energetic and healthy 69-year-old. Am I too old to train as a medical assistant?
Man, absolutely not. And your background that you bring to the table, your social work background, is really, really needed. It's one of the pieces that we see that sometimes when people are like, when my background in nursing is I'm a NICU nurse and a PICU nurse. I was not at all in tune to what social work would be bringing to those families. So if there was an RN or a medical assistant working in my field that had a social work background, that person would be going to meetings. And, I'll tell you, one of the coolest places where we see, I think, is when you look in behavioral health. Behavioral health seems to have about them that ability where the team comes to the table, and you have social workers and you have nurse assistants and psychiatrists and psychologists, and they really come together and they play nicely on what each person brings to the field. So social work is definitely needed. We truly need it. I tend to, in my own career, be a bit myopic, seeing neonates and peds and not understanding the family needs, that family is now taking home a child that needs special needs. I have no idea how to advise on that. A social worker, boy, that's where you're needed. And if you could come in and be in that assistive position, the team would love having you. They really and truly would.
Thank you. Well, I think that wraps up our portion together with Deborah Terry. I want to thank her, and I also want to turn it over to my colleague, Debbie Jaffe. Thank you, Deb. Nice to see you, and I'm going to let Deb take it away.
Thank you so much, Angela. And Deb Terry, thank you so much for attending today. I learned a lot, and I really enjoyed your presentation, and I cannot thank you enough. So thank you, Deb.
Thank you. Thanks for inviting me.
Take care. Okay, so what would this be without a way for you to get a job? We'd like you now to take a minute we're going to announce our upcoming healthcare career fair. Our career services will be hosting a virtual career fair exclusively for the healthcare field. You can update your resume, draft a cover letter, browse opportunities starting this coming Monday, April 26th. The event will close Friday, April 30th. So that's Monday, April 26th to Friday, April 30th from 7 a.m. to 5 p.m. We'll place the link in the chat box for everyone. And happy job hunting. Don't be afraid. My mother was a CNA until she was 81 years old. So I think that says a lot. So we're going to continue the presentation, and we're now going to go into the nursing area. So it is now my pleasure to introduce Dr. Janice Miller, the chair of our nursing program. Janice will be answering questions throughout her presentation. Hi, Janice.
Hello.
Janice is a full-time faculty member with the Associate Degree Nursing Program for the past 19 years. Janice is a 1980 graduate of the Associate Degree Nursing Program at College of DuPage. She received her bachelor's and master's degree in 1995 and 2001, respectively, from St. Xavier University in Chicago. She completed her doctorate degree in adult education from Northern Illinois University in 2013. She serves as a chair for the Program Participation Committee, along with myself, for the Nursing Admissions Program, and is a co-advisor for the Students Nursing Association. She's been recognized as Outstanding Alumni from the College of DuPage in 2017 and has published articles on preceptorship and mentoring. That's quite a lot, Janice. You've been a busy girl. I just have the pleasure of working with you always, and I've known you for 18 of those 19 years, and I want to welcome you today. Janice, it's all yours.
Thank you so much, everyone. I'm so very honored to be here to be part of this presentation. I wanted to share a few moments about the College of DuPage, what it has to offer our students who are interested in the nursing profession. So I would first like to share a PowerPoint presentation, and I might be sharing other things as well. And if you have any questions, please put it in the chat if you wouldn't mind, and I can share that with you. Can you see my screen? I'm hoping that you do.
Yes, we can.
Yes, okay. So my presentation today here is just to give you a little bit of a brief overview of our program. As Debbie has mentioned, I am an alumni, and so it wouldn't be complete if I didn't tell you a little bit about the history, because I am one of those early graduates. So what I have is, again, I had to pick a picture. I went perusing through all of the potential archives of the College of DuPage and just remembered my uniform in 1979, about these little these uniforms that with the caps and everything. So I looked a little bit further and I found a very interesting article. And this article was from the Courier from 1971, and it was with one of my former nursing directors, Mary Ann Santucci. And it was interesting, there was a little blurb in there about the applicants that came into our college, because we have been in the inception since 1969. And then in the fall of 1969, the program admitted 45 students, and 28 students graduated in June of 1971. Since then, there's been over 4,500 individuals who have been prepared to address the healthcare needs of the community in a variety of settings, such as hospitals, clinics, home health agencies, hospice, rehabilitation, community health, and long-term care. Our COD grads are everywhere. And so I just love this little paper clip that I got from the Courier, and I found this on the website. And at that time in 1972, if we saw that it was graduates of 28 students, I'm not quite sure what their cap of admissions was, but at that time in 72, they had almost 400 people coming into our school. So we have had quite a career of our reputation here as being very respected in the community. I just wanted to take just a few moments to explain our program plan of study. So let me share that with you. And I'm not going to take a great deal of time, but I do want to say that our program has 2 application cycles, one starting at the beginning of the fall semester and another at the beginning of the spring semester. And we take a maximum of 80 students. Students who graduate from our program will be conferred with an associate degree in applied science, which equates to 70 credit hours to complete. In addition, students who complete the program will be eligible to sit for the RN NCLEX state board exams. This allows students to join the workforce in a variety of healthcare settings, as I have previously mentioned. To obtain more information about our program, you can register to attend a nursing advising session, which we hold bi-monthly, and where faculty will detail the requirements for admission and will describe the program. So to give you a brief overview, I'd like to share a table that outlines the courses that students follow to complete their program, which is composed of 4 semesters. So if I want to take a share a moment, and I will get to that. This table here outlines our program of study. And so with this, it outlines what I would describe in the nursing advising session, where you would see all of the pre-nursing admission requirements to come into the program. And then these other blocks here kind of outlines the nursing courses that will be completed during your time with us.
Janice,
yes?
I just want to say that you need to share your screen on that page.
Oh, I'm so sorry.
That's okay. That's what I'm here for.
Yep. Let me just get to that. Okay, can you see it now?
Yes, thank you so much.
Thank you. Okay, so this again is, I'm just outlining it, and I will describe it just briefly. We have a curriculum here that outlines how a student will go through the program. Again, the amount of hours to complete the program is 70 hours. The first block of courses here are our prerequisites, courses that are required from our students before they, once they're applying to the program. Once they are provisionally accepted, then we have these other blocks here that tells in pretty much the sequence of how students will go through the program. So again, these are 4 semesters to complete the program that we have offered. This does not go through the summer. We do have a break there. So the students do have some courses that they can do for like open lab and skills remediation or that in the summer, but none of the courses that are listed here are offered in the summer. So again, it's quite filled. And also what we have in there is the also general education courses that are listed in this grid as well. This again will be explained thoroughly if you attend an advising session, so we could look over that together. And also we also advise our students who are interested in our program to make an appointment with a health advising advisor prior to them coming to a session. Now go back to the PowerPoints again. So I just wanted to briefly talk to you about what our program is about. I will discuss a little bit about the program outcomes that we have for our program, what a concept-based curriculum is, and that's something very different and unique from other nursing schools. But again, many again are trying to adapt to this nationwide. Our accreditation status and also our NCLEX pass rates. So we have developed through our faculty, when we developed our curriculum, was to develop program outcomes. And they're based on the performance on state licensure exams, program completion rates, program satisfaction, and program exit exams. We also have student outcomes, and our nursing program is consistent with national trends in nursing education. They correlate with the quality and safety education for nurse competencies. It's called QSIN. And we have developed our curriculum to incorporate professional standards and guidelines. The details of our program outcomes are also located on our nursing webpage, and we will also address that too during our advising sessions. And many people have asked, because when they come into the program, what is exactly a concept-based curriculum? Now, concept-based curriculum is very unique. We had Dr. Giddens come to really address some her thoughts about what that might be, what a shift and a change that would be. So what she has introduced us to is to define what is a concept. Concept is an organizing principle or classification of information, and it may be simple or complex in range. And so these concepts can be considered the building blocks or the foundation of nursing theory. So how we've developed our program is that we have major core concepts embedded in all of our courses. And so the learning experience we present to our students, again, according to our philosophy of nursing courses that we've designed even in its history, we apply these concepts, and it's in a way, when we present it, it almost seems like a flipped classroom in a way, where we have our students, again, our activities are not all lecture-based with a lot of lecture notes with PowerPoint presentations. It's what we like to try to do is have it more interactive and have that opportunity to engage with our students. And we found that very beneficial. And again, I think our students are liking it now too. And then I'd like to talk a little bit about our accreditation. So what does accreditation mean if you don't know? This is somewhat of a certification which demonstrates competency, and its purpose is to improve our academic quality and public accountability. And so we were awarded that in 2017. We full 8-year accreditation, and it's going through 2024. In the fall of this year, we're anticipating to again apply for reaccreditation, and so we'll be in full swing of doing that, and very busy this coming school year. Many of you might want to ask what our NCLEX pass rates are. At this time in the year 2020 was 95%. We're very proud of that, and we are anticipating to get some results from our December graduate cohort, and so we're anticipating those numbers as well. So I wanted to take just a few moments just to talk about some of the professional development for our nursing students that are enrolled in our program. We have our students involved in what they call guided study groups. Our students have an opportunity to build relationships and help one another through their program. by attending guided study groups. And these are peer tutoring services where students have been selected by the faculty. And what they do is they mentor and support students in their academic studies. This has been very successful for our program, as those who are working as peers, they grow in their knowledge, and it gives them confidence as well. And this gives them an opportunity to engage with the college at large. And so it's a great partnership. I'm sorry, let's get that again. Okay. They also have an opportunity to be involved in what they call the Student Nursing Association. The Student Nursing Association involves our students in service-oriented projects. They are encouraged to collaborate with relationships amongst their peers, and also it also promotes professionalism and leadership development. So we're very excited to have a group of students currently that cross the board in the different cohorts, because the students, as I mentioned, they have 2 enrollment periods. And so we have quite a few students in first, second, and third semesters. So they're all involved in this, and it's been great. Just recently, we had a panel discussion of Ask a Nurse, and these students had collaborated and got some of our own alumni involved, and had some really candid questions for them the other night to ask about, their experiences in their specific fields, like emergency room nursing, and some of those who were medics as well. So it's been really, really educating, really an opportunity to ask questions for them. Also, we have Alpha Delta Nu Honor Society. We would like to always recognize our students who have achieved high grades during the program. And so they are also involved in service-oriented programs. And so we do love to have this as part of their accomplishments through our program. And we have advisory boards that we maintain every year, and also our clinical partnerships. And I've listed just a few of the hospitals that we have, but we have other clinics, school nursing, long-term facilities that are also part of our partnerships that our students have experiences with. And so that's where they serve in our clinicals. And so we're so happy that we are able to have these partnerships, and that it's been really wonderful that they have partnered with College of DuPage. And then finally, we also have some information RN to BSN completion programs. We want to encourage our students to not stop here. As I mentioned, from here you have students will be graduating with an associate degree of applied science, and they can take their RN licensure as well. But we want to encourage their education, and these are some of our partners that we have through the College of DuPage. To find the information with this, I'd like to share with you where you can find that on the website. And if you give me one moment, I'll share that with you now.
We're not able to see your screen, Janice.
I'm getting there. Thank you.
Okay.
Okay, can you see it now?
Yes, we can. Thank you.
I'm so happy to say those who've worked on our website is wonderful. When you get to the nursing website at College of DuPage, we do have information of pre-BSN educational advancements, our 3+1 nursing programs. And so when you get through here, you can peruse through here. There are several programs that you can enroll. And so there are representation from each of these areas: Benedictine University, Governor State, Elmhurst, and Purdue, and also some other information regarding any advancement to our other affiliations with Loyola, Northern, and University of Illinois at Chicago. So once you link into there, you can at least see what are the requirements to enroll in them. Many of our students have taken opportunity to complete some of their programs to get their baccalaureates at Benedictine. So we have a really good partnership with many of them. And they come again to visit us during our meetings that we partner with every year. And this again, we have dialogue with them to see what's new and any of the changes of recommendations for their enrollment. So that's encouraging to see that we have this for our students who are with us for our 2 years. So it was mentioned today in our keynote speaker there, it was about the education. Yes, it's very true that, you know, we want all of our students to continue on for their studies. And again, that offers you a lot of opportunity for your future careers. So I'm going to stop, and I just wanted to ask if there's any questions.
We do have a couple of questions in the chat, Janice. Did you want to go ahead and answer those, or do you want me to read them for you?
If you could read them for me.
Absolutely. So we have a question. Do you think a BSN is required to work in Chicago area hospitals?
Most affiliations, a lot of affiliations, our institutions require a BSN. And I always tell students that, you know, if you are currently or progressing into a BSN program as part of an interview, your chances of getting in may be very good. We have a lot of our students who are December graduates who have gotten into Loyola already. So they just have shown that they're in progression of going for their BSN, enrolled in a program, whatever their choice may be, once they graduate from the College of DuPage, and they've been able to get their foot in the door. So just letting you know that it's possible.
Great. And then we have another person who said, do you think you'll be able to share your slides to all participants? Because they just wanted to make sure that they could go over them.
Sure, absolutely. And
Okay.
Is there a way that I can save that information and make it available?
Yeah, we'll take care of that with you after the presentation today and get back to you. Thank you for that.
Yes.
It looks like we have another person who wanted to let you know that this is our Bright Star sponsor, saying that the Bright Star nurses went through the program while working part-time at Bright Star. And it was a great place for them to work. And now she's an RN case manager, her most recent person going through Bright Star.
That's awesome.
And then we have another question from one of the people attending. And they want to know, what is the difference between a 2-year associate degree in applied health and a 2-year program for a medical assistant?
Good question. Medical assistant program, are you referring to just the degree?
Yeah, I think that's what it is, the 2-year degree.
I'm not quite sure if it's just the credit hours, general education requirements for that. So I would have to refer to you for a health advisor to probably determine or delineate between the two. That would be most helpful.
We'll do that. We'll get back to that participant and we'll give them the information to get contact with one of our health advisors at College of DuPage. Do we have any other questions for Dr. Miller at this time?
Debbie, if you could check the Q&A box, there are.
Yes, I was looking at the other box. Thank you. Let's see. Here's another question. Why COD for an associate degree then progress to another institution for a BSN versus say Chamberlain that offers a BSN in 3 years?
Mhm. Well, I think what you could think about if you're comparing and choosing schools, I always tell students, pray about whatever your decisions are. But as mentioned from our keynote speaker about cost, um, uh, when you finish our program, if you finish and complete the program in the 4 semesters, it may take you maybe not the 2 that looks like 4 semesters equivalent to 2 years. And again, if you haven't had your prereqs now, it looks like another semester to complete all that. If you compare price and things like that, which might be meaningful for some of prospective students of choosing which is which, that may make a big difference about, choosing which school to come in. So for me, I think that was for myself thinking about years ago when I was a daughter and my dad couldn't afford to send me to DePaul University nursing school. It was the best bet because I ended up working right away after a couple of years, and then I just progressed on. So many of your hospitals, wherever you might be working, might have some plans for you to complete your education while you are working. So it really is dependent upon you. I think that was meaningful to me. So I finished all my degrees without debt. How's that? And that really made a difference.
We have another question here. Is there a demand for LPNs? It seems years ago, the reporting was that LPNs were going away.
Okay, so as far as LPNs, there are opportunities for employment for LPNs, but it is limited. They have certain criteria at the hospital that they need to have at least an RN competency behind their name. And that's again, because there is a little bit, the tier or the way that you would look at their educational map, there is a big difference in terms of their educational preparation. So it will make a difference. So the LPN can work and function more so in some long-term facilities. And that would probably be the basics, maybe some clinics, maybe also opportunities for our students for that as well.
And then we have one last question, and then we're going to move on to the surgical programs, Janice. And that question is, and this is a big one, has COVID changed how clinical rotations are completed?
How has COVID changed?
Yeah, has it changed? Yeah, has it changed?
Yes,
The way they are.
Yes, I'm sure I can speak to a majority of nursing schools that are in the same boat as us. We, again, have partnerships with many of our affiliations, different hospitals. When COVID broke out last year, they said, we can't accept any students because of the risk. And that's the biggest thing. If you can think about how COVID is handled now, going into the ER, you got a loved one who walks in there, they're limiting anyone who comes in. So you can't imagine about nursing students not being able to come in. Right now, as soon as we are finding some openings now, we do have a capstone course that is currently going on right now. And so we have been able to secure some sites for our students to go in, actually physically go into these different sites. So, and again, it's relationships, with a lot of our affiliations. And again, we want to be very respectful to their rules and regulations.
Well, I want to thank you, Janice. As always, you're amazing, and you have a phenomenal nursing program at College of DuPage, and I've appreciated working along with you all these years. So thank you again, and any further questions we get, we'll send them to your way at the end of the presentation.
Thank you so much, Debbie.
Thanks. Okay, so now it's my pleasure to move on and introduce Anna Campbell. Anna is the chair of our surgical programs. Hi, Anna.
Hello. Thanks for having me.
Anna will be answering questions at the end of her presentation, and she is a CST CSFA for the last 25 years. And you look really young, Anna. It's hard for me to believe that.
It was.
She continues to work as an assistant specializing in orthopedic surgery. She's been teaching for 5 years and loves the combination of the two professions. She currently holds a Master's of Science degree in healthcare education. She's completing her PhD in education in curriculum and instruction. And Anna believes caring for others is a beautiful gift. She will teach our students to care for patients as we would care for our families, and to always place the needs of the patient above our own. Anna, I would love to hear about the surgical programs, as many have already requested in the chat. So take it over.
Awesome. Thank you so much for the warm introduction. My name's Anna. Thanks so much for coming. I love that this many people are interested, and been in healthcare, like Debbie said, for quite a long time. I've been in the OR for over 25 years. So I love talking to students about these programs and getting you guys excited about joining us. So I am covering 5 programs. So you're stuck with me for a while. I'm going to try to I'm going to try to get to questions after each of the programs rather than at the end, if that's okay, Debbie. I know we talked about that a little bit.
No, that's fine. That's fine.
Wonderful. Wonderful. So please feel free to continue typing those questions into the chat. Okay, I am going to get started here. Let me share my screen. Okay, so like I said, I am going to be talking about 5 programs today. All of these programs are focused within the operating room. You can kind of see it behind me. Cool picture back there. It's kind of this secret place in the hospital nobody knows anything about unless you watch Grey's Anatomy, which can tell you a little bit, but they're not exactly on everything. But a couple things I want you to know about all of these programs within the operating room. We do require, there's certain essential functions that you really have to have in order to work in this area. It is extremely physical. Some of the areas can be extremely physical. So it's really important that you kind of reflect on your characteristics and the type of person that you are, and is this a great fit for you? Okay. I do have a detailed list of these essential functions on each of the programs I'm going to talk about. There is a detailed list of the things that you should be able to do within each profession. If you have any questions about that, and this, you're going to hear me repeat this 100 times, but if you have any questions, further questions about something like essential functions, always feel free to reach out to the program chairs. They have an excellent idea of what it's like to actually work in those areas. Okay, so Deborah Terry talked about mobility in healthcare. It's really an excellent thing that she said. It's very honest. We tend to move around from profession to profession within healthcare. And to have the ability to go to different professions and to move up in different professions is exactly what our surgical programs do. We have this really nice pathway that allows you to go into different professions within the hospital or surgery center for that matter. So we do offer these 5 programs at COD. All of our 5 programs require this first course, Ethical Considerations in Healthcare. So it's a great place to start because it works with each of the programs. This is a 3-credit, 8-week online course that teaches the ethical and professional expectations of healthcare. After completion of ethics in healthcare, the student then would head into several directions. So this is where you can have some choices in what you do next. First, you could choose anesthesia technology. This program is an Associates of Applied Science degree and can be completed in 2 years. The other pathways, and again, I'm going to go into detail about each of these programs in just a bit here, but this is just to kind of show you how our pathways work. The other pathways begin by choosing one of 2 certificate programs. First, we have Central Sterile Processing and Distribution. We also call this CSPD. Or we have Operating Room Patient Care Technician. This is also referred to as ORPCT.
Each of these certificates can be completed in only one semester. It's kind of awesome. Both can offer jobs, so you can work in those areas, but then they also can lead to our next program, which is our surgical technology program. You do need both of these courses to get into that surgical tech program. And that program is an Associates of Applied Science and Surgical Technology degree program. That program, so your full commitment is 2 years to get that surgical technology program completed. You can work as a surgical technologist and then move on to our Certified Surgical First Assistant program. This is a 1-year certificate program, and it basically, and again, I'll talk to you more about what it does, but it's a further certification that allows you, it kind of broadens your scope of practice within the operating room. So you can do things like close patients, and it's very cool. We'll talk about that shortly. Okay, so let's dive in a little deeper here into each of these programs. We will start with the Anesthesia Technology program. This is an Associates of Applied Science degree. As I mentioned earlier, this is run by Dr. Kathy Kabai, who you see here. Kathy is a veteran OR nurse and anesthesia tech. If you do have a paper and pen, this is a great time to write down Kathy's email or phone number. I believe that this will all be shared so that you can get that information at a later time as well. But again, any questions at all, if you want to sit and talk about something, if you have questions about the profession itself, she's a great contact person. She is the contact person for this. Okay, so let's talk about the career itself. Every patient that enters the operating room requires some form of anesthesia. And this is like the ability to block pain caused by this procedure that they're about to have done. The anesthesia tech functions as an integral member of a surgical patient care team. What the tech does is assist the anesthesiologist in any way that is needed. This means that you will provide maintenance and servicing to the anesthesia equipment, and also assist with any kind of care that is needed for that anesthetized patient. Anesthesia technologists are hired in hospitals and surgery centers and can start anywhere from $19 to $24 an hour. So students must follow certain steps for admission into the AT program. You want to begin by reaching out to Dr. Kabai, that's your first step, and attend a mandatory advising session. Next, you'll want to become a COD student by applying at cod.edu. And anytime, and this is, Debbie will attest to this, our admissions area, our health advisor, everybody can help you with that process. You also want to make sure to send in all official transcripts from any other college you may have attended. So that's, if you took one English class 15 years ago, send that in. Make sure you're sending all those transcripts in. Students will also have to complete the following general education courses. So there it is. You will need 2 communication, which is like speech and English. You'll need a math course, a physical and life science course, humanities, social and behavioral science, and 1 global multicultural studies course. Also, don't forget that Surg Tech 1000 that you saw on the last slide. That also must be successfully completed, which is a C or better for our healthcare programs. Program highlights. The AT program is accredited by the Commission on Accreditation of Allied Health Education Programs, KHEP. That's what we always call it, KHEP, because it has such a big name. After successful program completion, the student is eligible to sit for the national certification exam offered by the American Society of Anesthesia Technologists and Technicians. This certification is nationally recognized, and it allows the technician to work in any part of the country. Okay, that would be a good time if we do have any questions for the AT program in particular. Deb, do you want me to take a look? Do I have anything in the chat? I'm sorry, I have, because I'm sharing the screen.
Yeah, no, I don't see anything. I think you're good to move on.
Okay, wonderful.
Okay.
And I will, if you guys come up with something by the end, I'm here for a little bit. So if you come up with something, feel free to enter an AT anesthesia tech question in the chat and I can address it at the very end of the presentation.
Oh, Anna, we have a
Yes.
late quick question. What is
Sure.
the job outlook for ATs?
Ooh, it's a tough question because it is kind of an up and coming profession. There's ATs, you can find an anesthesia tech job pretty readily. They're available all over the place. What COD prepares you for is more assisting with the surgeon. So you actually will learn how to put sterile gloves on and I'm sorry, not the surgeon, the anesthesiologist. So yes, you will have the ability to find positions. That's going to be all over within the city and the suburbs. And the job itself, the AT, the certified AT job appears to be up and coming where you're going to see a lot more of those positions available as well. I'm sorry, I don't have the numbers. It would be something I'll write down and get back to you about. If that's okay, I'd love to get you. Usually we have, specific job outlook numbers.
And then Anna, we have one more person who wanted to know how many students you accept per year.
Usually I think she's around 20 that she accepts. And I think that's a give or take. It will kind of depend on the clinical hospitals that are available because it does require a clinical rotation. You have to do some 1 to 2 days in a hospital setting throughout the program. So especially with COVID, we have lost some sites here or there. So that kind of depends on the number, but typically around 20.
Okay, I think we can now officially move along. Thanks, Anna.
Awesome,
Okay.
no problem. All right, moving on to ORPCT or Operating Room Patient Care Technician. So I lost my spot here. Let me get rid of that. I am the program chair for this program. So if you do have any questions, always feel free. I can't stress that enough. Send me an email. I'm checking those things all the time, probably too much. I'm checking my email. So always feel free to send me an email to ask me about any of these programs, and I can always direct you in the right spot if it's something that I don't know about. But let's talk a little bit about ORPCT. So ORPCT, I'm sorry, let me find my spot here. I lost it a little bit. The ORPCT assists within the OR in many different aspects, okay? So some of these duties would include opening the sterile field and supplies. We have to have, there's certain sterile areas that only sterile people who know how to use this technique can work within. So opening sterile supplies and creating that sterile field, transportation of patients, assisting room turnovers, meaning that we want to, after a patient leaves and then before the next patient comes in, there's a lot of cleaning that has to be done in preparation. Patient positioning is also something that, so you'd be one of these members of this picture that you see here that would help move that patient into position. Or PCTs are hired at hospitals, surgery centers, and sometimes private practices. The starting pay can be around $12 to $14 an hour. This program, this position, it can be a little bit tough as far as careers. Like if you looked on Indeed, it might be difficult to see specifically ORPCT. There are a group of hospitals in the suburbs that are hiring specifically ORPCTs. What this would do is give you, so what I recommend to students, an excellent thing to do is to take the CNA course as well, which is a certified nursing assistant course. That's an 8-week course. You could connect it to this certificate, and it really opens the doors for employment within the hospital. That CNA really helps you to get those positions within the hospital. And then the ORPCT part really helps you to get within the OR setting itself. I know some of that can be a little bit confusing, but okay, so how do I get in? How do you get into ORPCT? Students can register for ORPCT by sending me an email. Okay, that's you need consent of an instructor to register for the course. So send me an email and request permission for registration. After the permission is granted, then you should personally reach out to the Office of Student Registration Services to complete registration. Unfortunately, this program, you cannot just register for it online right now. So you do have to call to get your registration. After you get the permission from me, then you have to call into the Office of Registration. The structure of the ORPCT program includes an extensive lab. It's really fun, actually. This lab, you'll master over 20 different OR skills, and this allows you to function safely within an operating room. So you'll practice, you demonstrate, practice, and then you'll test out on these skills, these 20 different skills. After successful completion of ORPCT, combined with Surg Tech 1000, you will be eligible for that College of DuPage Operating Room Patient Care Technician Certificate. This certificate will absolutely look great on a resume. This will help you to get into those PCT positions at a hospital. And then also, if you go on to Surg Tech, it looks wonderful that it's one more certification on your resume. Okay, that one was quick. Questions on ORPCT? I'm gonna take a sip of water.
I don't see any questions, but I do think that it would be good for them to know how old you can be to get in your program.
Oh, I like that, because it sounded like Deborah was talking about that earlier. I don't have, to be, you're saying age. I thought you were saying
Yes.
like, how old can you be? I'm like,
Yeah.
oh, everybody, come on. For ORPCT, you can work as an ORPCT while in high school. So 16 is, for the CNA program, correct as well, Debbie, correct?
Yes, I just wanted to
16.
make sure that you announced that for your program as well.
Yes, so 16 would do it. Yeah.
Okay, great.
Thank you. Thanks for reminding me to talk about that.
Oh, you know me, always a recruiter.
I like it. I like it.
I don't see any other questions for this particular one. You did a really great job going over it. So I guess we're safe to move on.
Wonderful. Wonderful. We'll keep moving then. Okay, central sterile processing and distribution. This program is chaired by Jenny Serpa. She's been with the college for years now. She's just excellent and is your main contact person for this particular program. Jenny is a CST as well. So she really does a great job advising you on how to move forward, and then has made just wonderful contacts within sterile processing departments throughout hospitals in our area. So just does a great job with helping you with jobs and everything. So she's an excellent person to reach out to with questions for CSPD. So let's talk about it a little bit. What is sterile processing? The sterile processing department is an area of the hospital or a surgery center where the cleaning and sterilization of devices or instrumentation, which is used in the medical procedures, where that all takes place. So duties of the sterile processing technician include decontamination of instruments. So you're going to wash all the blood and body fluids off of those used instruments. After the instruments are cleaned appropriately, then they will be assembled and packaged into instrument trays. After the packaging, they will be sterilized and then stored in areas like this, looks like this. And then waiting for the OR to let us know, okay, what instruments do you need? Here's what I need for this procedure. Then as a sterile processing tech, you're collecting all those instruments and bringing them to the OR. So that's that distribution part. Sterile processing techs are hired at hospitals and surgery centers and start anywhere. We've actually bumped, which is really cool. You're usually going to see around $15 an hour, but I've heard of some surgery centers that are actually hiring at $20. which is really impressive. This is a career. I still will go to the OR to keep my skills up. And this is something we're constantly talking about, is the importance of sterile processing and getting skilled sterile processing techs in those positions. So very cool profession. I'm very passionate. It's a really important profession for patient care in the operating room. Admissions into this program require granted permission from the program chair. So to start this process, you would start with viewing the online advising session, and you would find that at cod.edu. There's a link that you can click on, and it'll walk you through the whole thing. It's just a great place to start. After you do that, then reach out to the program chair, reach out to Jenny and tell her you're interested. It's very similar to that ORPCT program where you reach out to me and I grant you permission. So it's the same type of thing. The CSPD program is offered in 2 formats, both of which offer eligibility to sit for the certification exam. The online option offers all components of the program, lecture, lab, and clinicals, but it's in a 100% online format. The second option, sorry about that, the second option includes an online lecture, but also has a clinical rotation within a hospital setting. So this option is always what we recommend. If anybody has interest in getting a job within sterile processing, so often people will get that job, and I think Deborah mentioned that a little bit, get that job in sterile processing, get the tuition reimbursement, and then continue to work on your education. So we really highly recommend that clinical portion for anyone who's interested in getting a position as a sterile processing tech. So on successful completion of the CSPD program, students will be eligible to sit for a certification exam. The student may choose the International Association of Healthcare Central Service and Materials Management. It's just a mouthful, isn't it? Or we call it ISHM. So that's how you can refer to that one. Or the Certified Board of Sterile Processing and Distribution, or the CBSPD exam. So you, after completing this program successfully, you can sit for either of these certification exams. Both certifications are accepted at facilities throughout the country. Whew, okay, I buzzed through that one. Any questions on this one? Sterile processing, any questions?
I don't see any. I think you're doing a great job.
All right, tell me if I'm talking too fast.
No, you're doing fabulous. And I love your presentation.
All right, we'll keep rolling here. Okay, surgical technology. Look at that, me again. You're gonna be sick of me by the end of all this. I am the program chair for the surgical technology program. Again, I've been a tech and an assistant for, I'm actually coming on over 26 years now. I have to change that in my bio. So I just love this field. I couldn't be more passionate about this field. And so I get excited about telling anybody. And really, obviously I've been doing it so long that I'm like, come on, let's go. You want to do this job. Okay. So let's talk a little bit about it. So that's me. If you have any questions, always send me an email. Okay. And again, like I said, I'm checking those all the time. So I'll get back to you with any question you might have. Okay, so Surg Tech, on completion of, think of that pathway, those stones that I showed you in the beginning, on completion of Surg Tech 1000, or PCT 1001, and CSPD 1111, students may apply to the Associates of Applied Science and Surgical Technology program. What surgical technologists do is we are experts in sterile technique. Okay, this is one of our labs actually, but all this area in blue here, this is the sterile field. That means that there's no microorganisms on that whole sterile field. So like you can see, this hand right here cannot come close to that sterile field. So what we do as Surg Techs is become experts in sterile technique and that sterile field to know how to assist in the operating room and assist that surgeon in the operating room. So we work under the supervision of a surgeon to facilitate a safe and effective surgical procedure. We set up the necessary supplies and pass instrumentation to the surgeon during the surgical procedure. The operating room is fascinating. It's exciting. It can be stressful, I'm not going to lie, but actually within our program, we even cover the stress of healthcare and how to deal with it. So it's something that we're constantly talking about. But surg techs, so CSTs, certified surgical technologists, can work in the operating rooms located in hospitals, in surgery centers, and then there is like plastic surgeons' offices that will have surg techs there as well. And in Illinois, we're looking between $20 and $25 an hour. Again, you can see a little bit more than that. You can see a little bit less than that. But really that 20 is I think all of our students last year who were hired at a minimum of 20. Okay, so to get into the surg tech program, you do have to follow certain steps. So that advising session it really explains everything. And then our admissions packet that's on cod.edu, you really just need to read through it carefully. It offers like a checklist that you can go through one step at a time to make sure you're following all those steps correctly. But so start by viewing the online advising session. And then next you want to make sure that you are a COD student. So you'll see a lot of similarities here to that AT program. Make sure to send in all official transcripts from other colleges. That's a big one. We want to make sure we have those all on file. You will need a health science application. That is due by August. So we have that, I believe it's August 15th. I have to check for this year for 2022 start. But so I would need your courses completed by summer for that 2022 start. So if you don't have the prerequisites, I know we are full for summer. So let's say you don't have those prerequisites for 2022. If you reach out to me, I can help you with an education plan so we can get you started so that you're thinking for 2023 to begin. Students will have to complete general education courses. So this is similar to that AT program. That we pretty much are requiring all of those same courses for right now. So that is something like, let's say you don't have the prerequisites, those surgical prerequisites for this year, you can really take your time through the gen ed courses as well and then be all set for that program in 2023. Just like the AT program, Surg Tech is accredited by CAHEP. Again, that same accreditation agency. This is highly regarded in the community, and it really sets a very high bar that we have to maintain for our students, which is awesome. It's exactly what you want. There are programs out there that are not CAHEP accredited, so you can go to a Surg Tech program and you might be like, wow, I can do this program without doing a lot of clinicals, or I can do it completely online. And unfortunately, it's more difficult to get hired. CAHEP, you have to go to a CAHEP program in order to get that CST certification. That certification is through NBSTSA, or National Board of Surgical Technology and Surgical Assistance. And in the Chicagoland area, everybody wants that certification. Okay, so if you don't pick COD, which I highly recommend coming to us, but make sure that you're looking at that CAHEP program. After you are a CST, a member of CST, actually within the program, you become a member of AST, which is the Association of Surgical Technologists. This is our professional organization. It's great. They send you a magazine each month. You have to keep up with continuing education hours, so there's always opportunities for education. They have an annual convention, and they usually pick somewhere fun where you can go and learn a ton more about your profession. So very cool organization. And that comes with the program. We get you set up with that before leaving us in December. Okay. Oh, look, I forgot my thing. Sorry about that. Questions? Questions for Surge Tech?
We have one program and they want to know how long the program is.
Once you are in the Surge Tech program, it's 1 year. So it's 3 semesters. So it takes you, there's some, like I said, those general education courses that you'll have to take. You can get those done in about a semester, a little over a semester. And then the Surge Tech classes run 3 semesters.
Okay, and we have another question.
Mhm.
How often is this program started each year and how many students are admitted?
We start every January right now, and we take 24 students a year.
Okay, and a follow-up to that is, this person attended college 20 years ago, a BS and an MA in her degrees or his degrees. Will these courses be accepted as fulfilling the prerequisite courses?
Often, especially with a bachelor's or you have those general education courses, often those will apply. So you wouldn't have to take your English or your speech, or maybe you have a social behavioral science course or humanities course. You would, however, have to take Surge Tech 1000, CSPD 1111, and ORPCT 1001. Those you would have to take. And then also I need the science course to be within, I believe I have it as 5 years right now, that it has to be within 5 years. So, and that's a good thing. If you took anatomy 20 years ago, trust me, I'm with you, you forget it. So it really is helpful for the program. So it would be something beneficial to take it again.
And then we have a really nice comment from one of the people that said, this is a great presentation about surgical technology programs.
Oh, that was nice. Thank you.
Yeah.
Good, I was afraid I'd be boring by this point.
I have to say, I really enjoyed your presentation as well. It's been you've done better than Dr. Kabai, in my opinion. And I'm going to let her know that too. You did a great.
Oh man, you recorded that even.
Oh, it's true. It's true. Wait till I tell her. Wait till I tell her.
Oh boy. All right.
All right. Are there any other questions that we have?
I do have, I still have that essay, Deb. Am I out of time?
Yes, we are out of time at this point.
Okay.
But we can keep the surgical assistant program and we can also email that out to anyone who contacts that information. So not a problem.
Please. Yeah, I have the rest of the presentation just goes through who to talk to and very similar stuff where it just answers, it'll probably answer a bunch of questions. So yeah, please feel free to add that on there.
Oh, we sure will. And you know what, Anna, I want to thank you. I love your background today of your Zoom. It's awesome. It's awesome. And the people that are attending today not only are going to be eligible for 2 $450 tuition vouchers and 10 $50 bookstore vouchers, but they're going to be going on a tour and they're going to be able to see the OR room. So they're going to be able to see where you work and where you teach.
I love it. Have fun. It's a good time. I love it.
All right. Thank you, Anna.
Thank you.
All right. So we are going to move along to Krista. Hi, Krista. I see that you're here with us. How are you?
I'm good. How are you guys?
Good. Well, it's my pleasure to introduce you, Krista Brenner. You are the chair of our respiratory programs. Krista will be answering questions at the end of the presentation, and I'm happy to read them to you as well, Krista.
Okay, terrific.
Krista obtained an associate's degree in respiratory therapy from Marine Park Technical College in Fond du Lac, Wisconsin. She went on to obtain her bachelor's in healthcare leadership and a master's in healthcare administration from St. Francis University. Her career started in neonatal pediatric care in Milwaukee, Wisconsin. And in 2012, she had gotten married and relocated to Illinois, where she worked in leadership within a hospital and program development for a small company. Lucky for us, you moved to Illinois, so we can have you at COD. What Anna loves about her career choice is there were so many avenues to pursue after graduating, but she found as her first passion in helping children. From being in the delivery room for high-risk deliveries, all the way to teenagers with cystic fibrosis. Krista, it's a pleasure to have you today. I know that with the pandemic, respiratory care has been awfully busy. So we're looking forward to your presentation. So let's begin.
Thank you. Thank you. Just a small update. I am actually not the chair of the program. I'm the director of clinical education. So I like to say I have the fun part of the position where I get to organize all of our clinical rotations for our students and connect with all of our affiliated clinical sites. So Barbara Coe is my partner, and she is actually the program chair, who anybody that's interested will be spending a lot of time getting to know Barb as well. So give me a moment here and I'm going to share my screen with you. And you guys should see a presentation now, right?
Yes, we see it. Thank you.
Terrific. All right, so today we're going to be just spending a few minutes exploring what the respiratory therapy program is about. We're going to cover briefly, I'm not going to go into detail because we don't have too much time, but what is a respiratory therapist? Where do we work? A lot of our stuff is behind the scenes. And then what is an overview of what do our admissions look like and that kind of thing. So what is an RT? A lot of people have no idea what a respiratory therapist is. We call ourselves respiratory care practitioners, respiratory therapists. So what do? We staff in so many different avenues. So earlier today, they talked about respiratory therapy being on the rapid response team. So we are behind the scenes people. We might work in OR where we go and set up specialty gases. We might assist with a very difficult airway where they can't get a breathing tube in a patient's throat. So we need to potentially perform an emergency tracheostomy, putting in an airway into that patient's neck. We work all aspects of human life, from preterm deliveries all the way to our geriatric patient population, which might be a 80, 90-year-old patient with COPD. So we are all over the board. We are highly specialized in what we do. Some of our respiratory therapist team members will go on to additional schooling to become nurses. Some decide to go into stay in healthcare, but go on to become physician assistants is very common. And sometimes we can take avenues into sales, recruiting, pharmaceutical companies. So we have such a huge broad range of what we can do. We can work outpatient clinics where we might do specialized breathing tests on patients, do pulmonary education, pulmonary rehab. What kind of patients are we going to be seeing? Our patients that we see are going to vary all the way that we talked about, from neonatal to elderly. We work with patients with pulmonary diseases. So that might be cystic fibrosis. That's a genetic condition where a body of a patient with CF they're making too much secretions and they can't manage them. So they use us to help mobilize those secretions, keep those airways open. We work with COPD, asthma, emphysema, pneumonia, any kind of lung compromise. And then when we talk about what can we specialize in, what's really cool about respiratory is you will graduate from our program with an associate's in respiratory therapy. We are accredited by COARC, which is the Commission on Accreditation for Respiratory Care. And then you're going to sit for a national board examination. Whatever state you practice in, you would have to have a state license to practice in that state. But then additionally, after you are licensed and working and credentialed, you can go on to obtain different types of credentials. So I specialize in NPS, which is neonatal pediatric specialty. You can specialize in adult critical care. You can specialize in PFTs, sleep labs. So there's a lot of different specialty examinations that you can take to specialize even further in your career. Our salary and job outlook is phenomenal. So we currently are making, and this is a national average, $29.48 an hour, and that's from coast to coast. It's a national breakdown from the Labor Bureau and Statistics. So some areas are much higher, some areas might be a little bit lower, so it just depends. So that would give you a mean annual wage of about $61,000 a year. And our anticipated job outlook, we are anticipated to grow 19%. So from 2019 up until 2029, there's an anticipated growth of 19%, where we anticipate this incredible need for respiratory therapists. I can tell you guys right now, all of our class that's graduating in May of 2021, all of them that want to have jobs lined up, all have jobs lined up already. And the few that have wanted to wait to just focus on school and the finish line, they're going to have no problem getting a position almost wherever they want to work. So that's a really cool thing right now is when you graduate, you can work almost any hospital, region, territory you want to work in right now. We're going to talk about briefly just getting into the program. What is it going to look like? So you will have to attend an online advising session. That hyperlink is provided here. I don't anticipate anybody having the time to get to that hyperlink and write it down right away. So anybody that needs it, please reach out to us directly, and our contact information will be at the end of this PowerPoint. But when you get to this hyperlink, you are going to click right here on Respiratory Advising Session. You're going to watch that online advising session that is put on by my coworker, Barb Coe, who is the program chair. And then you're going to fill out an interest form, and one of us will reach out to you and go over all the information requirements, see what you have, and go from there. Our application deadline for this to start in the fall of 2021, and we only take students in the fall semester. So our admission is in the fall, and we are hopeful to take 32 students in the fall. Our application process deadline is going to be on June 16th of 21 to be admitted in for the fall program. So you would have to have the submission of the online advising form first. In order to get admitted into the program, and this is going to be great detail in the advising session you'll be required to attend, you have to have a math course, a science course. We have a GPA requirement, which is 2.75, and we're going to cover that on the next slide. There will be communication placement testing, and you would have to have submission of a residency verification form. And we will talk about that in greater detail on another slide as well. So the GPA is going to be cumulative of 2.75. Our program is going to graduate you with an associate's in applied science. So to get into the program, you don't need to have the courses listed here, but in order to complete our program and graduate with an associate's and be eligible to sit for your national board test, you do need to complete the listed requirements there. It is absolutely possible to take these with your respiratory coursework. So the only prerequisites to get into our program for coursework is going to be that math and that science. So if you don't have these yet, that's absolutely fine, and you can work on those while you're in the program. The residency verification form, your document would be brought or emailed to SSC 2221 before or on the application deadline. Even if you are not a resident or in district, you still need to fill this out. The really cool thing is we are able to accept out of district students. The hyperlink for residency verification form is in our admission packet on our website. We admit up to 20% of out of district students because the majority of our clinical sites are out of district. So don't let this deter you. If you're interested and you're not in district at this moment, you still absolutely have a chance to become a student of our program. To mention, there are some disqualifying factors. In order to remain in the program, we just want to give full disclosure on everything and continue with our clinical training. The following must be completed in the first semester. So you'll need to complete a health screening and be willing and able to accept an annual flu vaccine and all other requested vaccines. This is because our clinical sites will require our students be up to date with vaccinations. Without them, we're not going to be able to place you into clinical sites, which is a requirement to graduate from our program. You would have to pass a drug screen. This one is a little confusing for people. Although cannabis is legal in Illinois, a positive test would cause removal from the program because it's not going to be allowed at any of our clinical sites. So you do need to pass a drug screen. criminal background check. The background check is required because you're working with patients. You're going to be provided a company contracted through COD. A disqualifying condition defined by federal or state law is not able to enter your clinical, and therefore we can't accept you into the program or to continue in the program if we can't place you into clinical, because you won't be able to meet the clinical requirements to graduate from our program. So this slide looks very busy. I know it's probably a little overwhelming to see all this information, but this is an estimation of our program costs that you're seeing here. So this is just an estimation. This is not, it might be a little bit more, it might be a little bit less. So your math and science are already required to be completed before you come into the program. So this estimated cost is if you do not have your other general education credits already completed. There's going to be 46 required course credits, but there's additional course credits to be able to graduate with an associate. So if you come in with some of those general eds completed, your cost would be a little bit lower than what we're projecting. But this is just to try and give full transparency of what would your 2 years, which is 5 semesters, look like in the program. And that's going to be an estimated cost of about $11,500. And again, just estimated. This slide is also a little bit busy, but some important things I just want to point out to everybody to see if this can potentially fit in your lifestyle for the next 2 years. So this is going to be our program overview, and this is the 46 credits that are required for the coursework for respiratory therapy. This is not the general education credits. So your first semester is going to be by far your busiest semester. You're going to have 16 credits in that first semester. You're going to have 8 hours of lab, and you're going to have 13 hours of lecture, and you're going to be in class Monday through Friday. The first semester is a doozy. The reason it's such a big first semester is because in semester 2, we want to get you into clinical right away, hit the ground running. And in order to get our students into clinical, we have to be able to have objectives met with coursework prior to placing you in clinical. Semester 2 and 3, semester 2 will be in the spring. Semester 3 is going to be a summer session. Semester 2 and semester 3 are both under part-time credits. What that means is if you do need financial aid and you have outstanding courses that need to be completed, semester 2 and semester 3 would be a really great place to plug those courses in, because you're going to be able to then get up to that part-time status to qualify for your financial aid if you are using it. So semester 2 is going to be 5 credits, and that's where we get you into your clinicals right away. The majority of our clinicals are 12-hour shifts, 2 days a week. We do have some facilities that do 8-hour shifts, 3 days a week. We don't guarantee placement at any clinical, but what I do make every effort is to try and place you somewhere that you want to be. It's a win-win for you and for that clinical site, because your clinicals serve as an unofficial job interview for you. And again, there's no promises that you'll end up where your preference is, but I do make every opportunity to try and make it a priority. So semester 4 is when you move into being a second-year student, and that's going to be in the fall. So the fall of the start of your second year, you're going to have 9 credits. You're going to have lab for approximately 4 hours. You're going to have approximately 5 hours of lecture, and you're going to have 24 hours of clinical. So our program is very heavy on the clinical component of this. You absolutely get a lot of hands-on in lab, but a lot of our good learning opportunities are going to come from clinical as well. And then semester 5 is the semester you're going to be graduating. So this will be in your spring semester of your final year. Semester 5 is going to be 12 credits, Monday through Friday. So it is going to be a longer week again. But this is where you get to do all of your really cool rotations. So you're going to get to do a neonatal pediatric rotation, a home health rotation, long-term care. We're working with some facilities to see what other creative opportunities we can get to. You'll do pulmonary function testing and pulmonary rehab. So a lot of really cool opportunities to see what all is out there in that final semester. So this is just an overview to see if this could potentially fit with your lifestyle where you're at currently. So when we graduate, you will be graduating with an associate's degree. And what's going to happen is our program is accredited by COARC. As mentioned in other presentations today, you want to make sure that whatever school you choose, which I hope is always COD, I'm very partial, but when you graduate from a program, you want to make sure that that program is accredited by the accrediting body. That's going to serve you well to make sure that you can sit and test for your national exam and to make sure you can get a state license. So make sure that your program is COARC accredited if you're looking at respiratory. After you graduate from our program, you are going to sit for the national, it's the NBRC, it's the National Board of Respiratory Care. You're going to sit for their exam, and they have 2 different examinations. Our program trains you to pass at the high cut. That is our goal for every single one of our students. So there is a certified respiratory therapist, which is baseline for entry into the profession, but then there's a registered respiratory therapist, which is it's an additional test over the certification. And again, we prepare you to be a registered respiratory therapist in our program. That's going to be really important to get you into the working world. And then once you pass your NBRC credential, you'll be able to apply for a state license. In Illinois, you are required to have your NBRC credential to apply for your state license. And then what's going to happen is your state license will expire every 2 years. This is pretty typical for most careers in healthcare. You'll renew every 2 years at the state level. And in Illinois, what we require is, in order to keep your Illinois state license, you need to have 24 continuing education units every 2 years. This is ongoing training, and most of these events you can get for free from different ventilator companies and websites. You can attend different seminars in non-COVID times. So that's going to be what's required at Illinois state license level. This last slide is going to be my partner's information, Barb, who is the chair of our program. So you'll see her office phone number along with her email, and then you'll have my information right underneath it, my office number and my email. We are looking forward to hearing from you guys, and hopefully you guys have some interest and we start to see you guys soon.
Krista, we have a question. Our
Yes.
first question is, what are the benefits of continuing on to a bachelor's degree?
That is an amazing question. So I encourage every single one of our students in our programs to continue their education. The benefits of a bachelor's degree is going to first make you a more robust clinician. Even if you decide that you want to stay at the bedside for your entire career, which is wonderful, and I would still be at the bedside if it fit my lifestyle better. It's good to have your bachelor's because it's going to make you a much more well-rounded clinician when you're practicing with patients. The other benefit is that it's going to help allow you the opportunity to progress in your field. So that might mean you work as a therapist at a staff level for a few years. Maybe you apply for a supervisory role, an educator role, or perhaps you want to move into sales or pharmaceuticals. It's going to allow you the opportunity to pivot into different areas, still staying within respiratory if you desire, but to pivot into different areas with it.
And then we have another question. Is your January 2022 class full?
Great question. So we don't admit any students for January. All of our admissions will be for fall admissions. So our fall cohort, so fall of 2022, we will close application deadline in June. So it is still open. We are accepting applications. And if they're interested, absolutely get right over to our website, watch that advising video, see if you've met the prerequisites and apply, because you could start as early as fall if you want. If fall of 2021 doesn't work for your schedule, get on those prerequisites if you don't have them, and you can start in fall of 2022 potentially.
I don't know. Are there any other questions? I don't see any other questions. Okay. Thank you so much, Krista, for this wonderful insight. We did get a compliment instead of a question about your presentation, and they enjoyed learning about it and about the CE, et cetera. So that's wonderful. And thank you again for coming. I appreciate your attendance, and I hope everyone has an insight to what you guys have been doing during COVID and saving so many lives. We appreciate it very much.
Thank you.
Thanks. Okay, so now we're going to move along. It is time to change it up a little bit. We're going to take the College of DuPage first virtual tour of the admissions and health science buildings. Yes, you're the first to see the virtual tour. We're very excited to be able to share this today at our grand opening of this virtual tour. The Spotlight on Essential Health Careers will highlight over 30 select College of DuPage healthcare programs, educational opportunities, including the surgical careers, respiratory, and nursing pathways. You're going to be able to take a virtual look behind the scenes at the Health Science Center, the facility, the classrooms, the labs, and I've got to tell you, this is something that hasn't been open for a while, and it's just exciting that we're going to be able to share it with you. So it is my extreme pleasure to introduce our moderator of the virtual tour, Rio Almaria. Rio?
Thank you, Debbie, for the introduction. Again, my name is Rio, and welcome to our first ever virtual tour. Today, we begin our tour in the Student Services Center, also referred to as the SSC. This building houses many departments that focus on our students, getting the help they need from starting with the college to gainful employment. First up, we have the Admissions and Outreach Office. Prospective students can meet with COD admission representatives throughout the year to help them with answering general application and onboarding questions. Our welcoming staff are currently offering Zoom and phone appointments. Next, housed in the lobby of the SSC, you will find the friendly staff of Campus Central, which can also be considered as the college's information hub. The Campus Central staff provides students with and community members assistance from enrollment questions to directional help when we are physically back on campus. The Office of Student Registration is also located in the lobby. It's the department that assists students with searching and registering for classes. In addition, this office provides information regarding cooperative or joint agreements that COD offers with other community colleges. And we also have the Student Financial Assistance Office. Students can receive help throughout the year with questions regarding financial aid, in addition to learning about grants, loans, and other financial resources. This office can assist with scholarships offered to our students every fall and spring semester. We will now visit the third floor of the SSC to our Veterans Lounge. This is located right above the Student Registration Office, and it is a dedicated space where COD's Veterans Association meet monthly to provide a community of camaraderie and support for our veterans. COD prides itself with being a military-friendly institution and designated school. In conjunction with the Veteran Services Department, the staff helps veterans to manage their benefits towards their education. We also have the Career Services. The Career Services Office provides job searching strategies for our community members, students, and alum. They conduct a successful job fair every year and workshops that help individual with the getting hired process. We also, right there, it's getting pointed out, we have the Center for Access and Accommodations. The Center for Access and Accommodations provides assistance in receiving accommodations for students with IEPs and 504 plans. The accommodations that COD can provide can include extended test time, test readers, or preferential seating when we do return back to in-class lectures. And lastly, the Counseling and Department. This is the department that helps students to develop their student academic plans. Counselors and advisors help students with their to reach their educational and career goals, and also provide seminars, workshops, and appointments promoting mental health. So now we go on to our main event, the Nursing and Health Sciences Building. This building creates an environment of collaboration and innovation for students, faculty, staff, alumni, and our campus and community partners. First, the lab that you see here, this floor houses our physical therapist assistant lab. PTAs work under the supervision of licensed physical therapists to provide skilled, direct patient care in a variety of settings, including hospitals, rehabilitation centers, long-term care facilities, sports medicine clinic, and home healthcare agencies. The PTA program is completed over a 5-semester part-time night program. 100% of COD PTA program graduates who sought jobs were employed within 12 months, and 24 students are accepted into the PTA program each year. Out-of-district clinical sites may admit a maximum of 20% of out-of-district applicants to the program based on merit. We also now are showing the respiratory care patient simulation room and lab. Graduates of the program provide basic cardiopulmonary support from emergency oxygen administration to management of computerized life support. Respiratory therapists work in clinical and hospital settings, home care environments, intensive care units, emergency rooms, diagnostic laboratories, and skilled patient care centers. This is a 2-year program, and most students do have some type of employment while they are in the program. First-year students do not have clinical rotations in the first semester, and currently COARC, our accrediting body, allows us to accept up to 40 students at a time. The program currently has 2 articulations to a bachelor's degree. One is a 3+1 through Concordia for a Bachelor's of Arts in Healthcare Administration, and the other is a 2+2 through Northern Illinois University. And our credentials are accepted nationwide. The next section of the building that we will be showing you is dedicated to our nursing programs. We have a hospital simulation lab and a second lab that mimics home healthcare environments. There are also 3 lab rooms and 4 testing rooms where nursing students practice their skills. Graduates of our associate degree in nursing program can sit in for the NCLEX RN exam and become RNs. For the year of 2020, the associate degree in nursing program had a 95% pass rate. Job placement rates for the past 3 years have averaged between 92 to 100% job placements. This is a 2-year full-time program taught during the day, and we accept 80 students about every 6 months. So now we are going to transition into our surgical technology program. Surgical technologists work closely with surgeons, anesthesiologists, registered nurses, and other surgical personnel. Before, during, and after surgery, they deliver patient care and perform tasks that help ensure a safe surgical environment. Support certificates provided are central processing distribution and operating room patient care technologists. Additional certificates provided are surgical assistant and anesthesia technologists. If you are a student that likes science classes that focus on biology, anatomy, physiology, and medical terminology, these are the programs for you. It is recommended that high school students check with their high school coordinator to see if you're eligible for any articulated credit at COD. And some of these programs are also applicable to our 3+1 program agreements with Concordia University in a Bachelor's of Arts in Healthcare Management. So next we are transitioning to our dental hygiene program offered at COD. A dental hygienist is a licensed preventative healthcare professional who provides an array of dental professional services. This is our dental hygiene clinic, which offers students the opportunity to learn and practice on patients. The clinic is open to the public and seeks patients, children, and adults for preventative dental services provided by our students at a reduced cost. Students can make whitening trays, study models, and learn about dental restorative materials. Now, applicants are not required to have dental experience if they're interested in our dental hygiene program. Due to the intensity of the program, it is recommended that students work a maximum of 10 to 14 hours a week while they're in the program, and it is strongly advised that applicants take as many or all of the general education class requirements due to the rigorous schedule of the program. We now switch over to our radiography lab. Radiographers take x-rays and perform a variety of diagnostic imaging procedures. We also have a state-of-the-art mobile x-ray machine. Students learn the skills necessary to produce high-quality diagnostic images of patients as directed by physicians who are qualified to order and perform such procedures. We have advanced certificates including mammography, MRI, radiation, and proton therapy programs. This is a full-time day program and is extremely time intensive. Students are either on campus or in a clinical environment 5 days a week for over just 2 years. Although the number of applicants varies, the program usually receives an average of 200 applications a year with an average of only 50 applications accepted. So next, we have our nuclear medicine lab. Nuclear medicine specialists help treat disease and image the body. Nuclear medicine professionals held about 18,000 jobs. About 7 out of 10 of these positions were in hospitals. Students will spend 3 days per week at a clinical affiliate and 2 days per week at the college, and it is a 15-month advanced certificate program. Now we are going to show you the lab that houses our sonography and vascular sonography programs. Sonography, commonly known as ultrasound. The most well-known application of the ultrasound is producing images of a baby prior to birth. Vascular sonography uses ultrasound to aid in the diagnosis and treatment of patients with disorders of the arteries and veins. Here's some key data from the class of 2019. This program had a student retention rate of 100% with a job placement rate of also 100%. And now we are going to switch over to our blood draw room and lab for our health science discipline programs, including clinical lab science and associate in science transfer degree, a medical assistant degree, a phlebotomy and EKG certificate program. This room is named the Bradford Phlebotomy Lab after a generous donor to the college. In addition to the development of clinical and patient care skills, educational programs are also available for students interested in lab work, research, and medical office administration. Now we take you to our computed tomography program. College of DuPage is the first community college in the nation that owns their own General Electric CT scanner. It's located in the state-of-the-art classroom on campus that will provide students with this exceptional hands-on training. And lastly, we would like to show you a series of science and lab classrooms providing space for instruction and learning. We have 2 advanced anatomy and physiology labs, 2 microbiology labs, an open computer lab, and 4 general classrooms. Most students complete a 2-semester sequence of A&P courses. Both sections are offered with or without a cadaver, and a cadaver storage area is located between the classrooms. There are 4 general chemistry labs, 2 organic chemistry labs, and 1 biochemistry lab, in addition to the 2 general classroom areas. So in total, we have 6 biology labs, along with a botany lab. There is even an outdoor greenhouse for our botany classes. So that concludes our tour for today. And now I'll turn it over to Debbie. She is up next.
Thank you so much, Rio. That was fabulous. You did a wonderful job. I hope you all enjoyed it. During the session, we did have a chat and somebody said that that was really awesome. And I agree. I think it's an awesome tour. Again, this will be recorded later so that if you want to go through the tour yourself and take a self-tour, that will be available. All right, we're going to change it up. We're getting towards the end, and now I want to have you join us for our next short video regarding programs we offer in healthcare in our non-credit continuing education area of the college. Gosha?
College of DuPage Continuing Education offers several short-term, non-credit career training programs in the healthcare industry. Our programs focus on high-need, entry-level healthcare professions where students can rapidly train and begin employment. Our short-term trainings help non-degree seeking students move into the workforce quickly, but they also serve as great starting points to explore higher-level healthcare disciplines and degree programs. The continuing education team actively engages and seeks input from leaders in the healthcare industry to provide top-notch training while meeting current workforce needs. Areas of study in our healthcare program include dental assistant, pharmacy technician, veterinary assistant, and massage therapy. College of DuPage Continuing Education also offers 2 very short-term healthcare training options with our caregiver and contact tracer programs. All of our programs are affordable and offered with flexibility, allowing many students to train for new careers while working full-time. Our dental assistant, pharmacy technician, and veterinary assistant programs are great places to start for students who want to train quickly and take a fast track to employment in these high-demand healthcare occupations. The Dental Assistant Program prepares students to deliver patient care and chairside support to dentists during exams and procedures. Dental assistant training can serve as a springboard into College of DuPage degree programs such as dental hygiene or even into dentistry programs at other colleges and universities. Our pharmacy technician training is recognized by the Pharmacy Technician Certification Board and fully prepares students to take the National Certification Exam. Pharmacy technician students learn to assist pharmacists in all daily tasks while gaining the communication skills to effectively interact with patients and other healthcare professionals. Students passionate about caring for animals pursue a rewarding career with the Veterinary Assistant Program at College of DuPage. This hybrid program is designed to prepare students to work with animals in laboratories, animal hospitals, and clinics. Students perform surgical preparation and animal nursing under the supervision of veterinary professionals. These programs can be completed in 1 semester, and each includes a critical externship component. Externships integrate classroom knowledge and theory with real field experience, provide networking opportunities, and directly prepare students for employment. Massage therapy is also a fast-growing field and a popular program in the continuing education healthcare portfolio. Students are trained in Swedish massage and more advanced techniques, such as prenatal and trigger point. Our in-depth massage curriculum also includes study of anatomy, physiology, pathophysiology, and kinesiology, and prepares students to take the Illinois State Licensing Exam. Continuing education works closely with area employers in these high-growth fields to ensure that our comprehensive training is up to date and consistent with industry standards and needs. 2 other programs also offer students interested in healthcare an opportunity to gain skills necessary to seek immediate employment. Students who want to explore a career in nursing may be interested in starting off with our Caregiver program. This week-long course covers topics such as client communication, basic hygiene, infection control, time management, and patient safety in order to prepare students for jobs as personal caregivers. Our Contact Tracer program meets a critical community need in a quick and affordable virtual format. This introductory online course focuses on the science of COVID-19 and why contact tracing is an effective public health intervention. Students learn how to build rapport with cases and identify contacts to stop transmission in their communities. Continuing education's short-term healthcare training programs lay a solid groundwork for career and college pathways that meet a wide variety of students' educational and personal goals. Students who complete these trainings and achieve employment have taken a first crucial step upon which they can move up the healthcare career ladder. To learn more about all the short-term healthcare programs offered through the Continuing Education Department at College of DuPage, please visit cod.edu/healthcare.
Okay, it is now my pleasure to introduce Lori Garcia, the Program Manager for Continuing Education Healthcare Programs. Lori?
Thank you, Debbie. Hello, everybody, and thank you for joining us today. My name is Lori, and as Debbie mentioned, I am the Program Manager of all the healthcare programs in continuing education. Just a quick overview, continuing education is an arm of the college where we offer several short-term, non-credit career training programs, including healthcare. As Deb Terry mentioned earlier, don't worry about the staircase, just take the first step. CE is a great starting point to explore higher level healthcare disciplines and degree programs. Our brief video that you just saw gave you an overview of some of our programs, but please don't hesitate to explore and see what else is there to offer. Visit cod.edu/healthcare, or if you have any questions, please contact healthcare@cod.edu. Deb?
Lori, we have a question for you. Is there any hands-on training of pharmacy technician?
Yes, we do. Our pharmacy tech program includes externship. You will be placed with local pharmacies, our partners. We currently are partnered with Walgreens and Costco. And it is included, and there's no additional fee. It is included in the registration.
Are there any other questions we have for Lori at this time? Okay.
Thank you.
Thank you, Lori, for attending. We appreciate it. Great collaboration.
Thank you for the invite. Glad to be here.
Thanks. All right. So if we are going to be wrapping up here, and if we did not answer your questions, we'd like you to please send us an email or send it in the Q&A box, and we'll coordinate with the team presenting today and get back to you. We will also be recording this webinar, and you'll be able to locate it on the Spotlight on Essential Healthcare Careers website, where you can view the recording. And now it's time for the drawing, and I'm very excited, and I have a dog at home, and she's starting to make noises. So she must know it's time for this great drawing that we have entered all of you in for. So what we've done is there were 171 people who registered for this event. And when you registered at a certain time, and you went to a certain number in line. So that's your number. And so what we're going to do is start drawing the first winners of the book vouchers. We're going to start with a Follett's $50 bookstore voucher. We're going to say your first name and only your initial of your last name, because we all understand about FERPA and privacy. And then we will contact you within 2 weeks in order for you to get your vouchers. And keep in mind, there is a deadline of 2023. We want to make sure you can at least use them for that summer if you are in high school or if you are intending to coming to college at DuPage. So good luck, everybody, and here we go. All right, Gosha. All right, so it looks like our first winner is number 81. And what is the name on that person, Gosha?
Hi, Debbie. I sent you the names in the chat.
And I'm looking in the chat, and here we go. The first winner is Richard C. So Richard C., you are number 81, and you are a winner. All right, Gosha, number 2. Number 33. Number 33 is a winner. I feel like I'm playing bingo. Number 33. So we have Lizeth S. So Lizeth S., you are a $50 bookstore winner. Our next winner is 103. 103, your winner of 103 is, I'm waiting for the name. Here we go, Anna J. Anna J., you are a winner, 103. So we've gone 3, we have 7 more. Our next one is 149. 149 is Mariah W. Mariah W., you're a winner. Our next winner is number 49. 49, and that winner is, let's see. Dana G. Dana G. D-A-Y-N-A-G. So Dana, you're a winner. Our next winner is number 101, Julissa F. And now my puppies join us because she's so excited about this drawing. All right, the next number is 66. 66 is Angel V. Angel V, you are a winner. Our next winner, number 19. Number 19 is, the suspense is killing me, Stephanie H. Stephanie H is a winner. Our next winner of a $50 bookstore voucher is number 65. 65, the name that correlates to that is Anetta C. I-N-E-T-A, Anetta C. I hope I'm saying that right. Our next winner of a $50, are we still on $50 bookstore vouchers?
Yes, Debbie.
Okay, thank you. The little voice from behind is River P. River P, you're a winner of a $50 gift certificate. Another $50 gift voucher from Follett's Bookstore is Rebecca L. Rebecca L, you are a winner. Is that Tanya?
Deb, 136 was the last bookstore voucher, one for 50. I counted 10. So unless Gosha has different.
All right, so Rebecca L was the last bookstore voucher?
River P was.
Ah, River P was. Okay, well then Rebecca Lane, oh, excuse me, Rebecca L and Karen E are the two $450 tuition voucher winners, the grand prize winners of the day. So Rebecca L and Karen E. We'll get back to all of you within 2 weeks and tell you how to pick those up. So that was pretty cool. I got a little too excited there. All right, congratulations to the winners. And at the end of this, you will be getting a questionnaire. And the questionnaire, we would love for you to fill it out if you could. It will truly help us improve on our presentations in the future. And now a message from Tamara McLean, the Director of Admissions and Outreach. Tamara?
Thank you, ladies. What a wonderful presentation this morning and afternoon. We are so grateful to all of our presenters, all of you attendees. We hope you enjoyed all of the important information that has been shared. If you have any questions, we can remain on for a few more minutes to answer them in the chat box. I think everybody has been really good at putting those questions and being responded to. But if there aren't any other questions, we want to thank all of you all for coming again. Have a wonderful afternoon and weekend. And again, contact Admissions and Outreach if you have any questions or if you need any follow-up information from us. Thank you all for attending. Bye-bye.